Welcome to Health Diary. My name is Winnie Lubembe and we're coming to you from 4 Points by Sheraton right here in Hurlingham. Now, glaucoma is the second leading cause of blindness globally, affecting over 7 million people. So what exactly is glaucoma and what are some of the risk factors for the same? You do not want to miss that part of the conversation, which is coming up after this fact of the matter. Glaucoma is a group of diseases that damage the eye's optic nerve and can result in vision loss and even blindness. According to Centers for Disease Control and Prevention, CDC, half of people with glaucoma don't know that they have it. Although there is no cure yet for glaucoma, if caught early, one can preserve their vision and prevent vision loss.
Mimi nimekuwa diagnosed na hiyo glaucoma. Kwanza nimeenda kwa surgery ya cataract. Ikafanyiwa macho zote mbili mwaka wa 2018. Ndio nikarudi sasa mwaka iliyopita 2021 hapa mwisho ndio wakadiagnose hiyo na glaucoma. Ndio tena wakanipatia appointment nirudi, ndio wakanifanyia hiyo laser. Actually, hapo mwisho ndio kidogo inaanza kunipatia kitu kama dizzy. Nikilala au nikiamka nasikia kama kizunguzungu hivyo. Haijanidhuru sana kufanya kazi zangu. Manake gari naendesha na sioni dalili yote ikanipatia kwa tangu wakanipatia hizi madawa na wakafanya hizi vitu. Haijanidhuru mpaka sasa. So far nasikia sawa kabisa. Actually tangu wameifanya hiyo laser na wakanipatia dawa ya kama drip na iweka mara 4 kwa siku. Kwa macho yote mbili. Drop moja. Sasa wakati nimerudi ndio hiyo dawa imeisha, wakaniambia nisitumie sasa hiyo dawa mpaka siku ile nitarudi tena tarehe 23 mwezi wa 5. Yaani kucheki kama hiyo glaucoma ime-improve ama itanidhuru tena ama namna gani, ndio watajua kitu gani watafanya after that. Wakati wa kwanza nikienda kutolewa cataract kwa hizi macho zote mbili, nimetumia pesa zangu kwanza. Sasa hiyo ya glaucoma ndio nikatumia NHIF. Yaani ile kitu naweza kumwambia mtu yote akiwa na hiyo kumsihi aende mapema aone daktari, wafanye hizi scanning, wamueleze exactly kitu gani inamsumbua, habari ya hiyo glaucoma, na apewe matibabu. Maana akipewa matibabu ndio sasa pale hospitali watajua way forward ni nini, badala ya kuikaa naye alafu baadaye itakudhuru na kuweka ukue kitu mtu kama blind.
All right, let's get to understand more about glaucoma, and of course to help us with the conversation, we have Dr. Kibata Githeko, who is an ophthalmologist. Thank you very much, Dr. for making time for us.
Thank you.
We also have Delivan Mochoki, who actually recovered from glaucoma. Asante sana Delivan for coming by today. Kutuelezea jinsi ulivyo, pambana na glaucoma hadi sasa uko sawa. Right? So Dr. let's just start with you. Help us understand glaucoma, because it seems like a very big word.
Before even we go to glaucoma, let's understand the eye. So first, an eye is a ball. That's why it's called an eyeball. For that ball to stay a ball, the pressure inside the ball must be above the pressure outside. Otherwise, if the pressure outside is more, the eyeball will collapse like a balloon. That ball is then basically a camera. It captures what you see, processes it behind at the retina. Then once that is processed to electric signals, that electric signal is then sent by the optic nerve. So the optic nerve is a wire that connects the camera to the brain. Now if the pressure inside goes up, above the pressure of the blood entering your eye, It means your blood starts getting less and less, and your eye starts dying. That is glaucoma. And it is painless, or unless the pressure goes very, very high, then you start getting headaches, your vision goes blurry. But 90% of the people, you don't feel anything, you don't realize you're going blind because you lose sight from the side, and it is permanent and irreversible. And unfortunately, it is almost always in both eyes. Unless it's from, a car accident, or you are hit with a tennis ball, trauma of some sort.
So for you, Delivan, glaucoma ilianza 1998. Nini ilifanyika ndo ukajulikana kwamba uko na glaucoma?
Wale wazungu walikuwa wa mission, walikuja hapo na kliniki yao inaitwa Maranatha hapo Kibera. Ndio waliangalia, walinipatia dawa kwa miaka 2. Nikiweka tu, ni wakikuja wanaangalia, wanasema imepona. Namwambia mimi sioni kama imepona. Naweka block body pale, iko na numbers.
Wanakuambia uko.
Ananiambia soma. Nasoma. Mahali ingine haisomi. Inafika mwisho.
Yeah. So kabla uende hospitali, wazungu wakaangalia, wakaona kuna glaucoma. Ukiwa nyumbani ama ukifanya kazi yako, ni nini ulikuwa unasikia yenye ikakupeleka hospitali?
Mimi nilikuwa nikifanya shughuli zangu, naona kama kakitu kameingia ndani. Kama vumbi hivi. Sasa mimi nafanya hivi, alafu mimi naendelea na shughuli yangu. Sasa vile walanipatia dawa ingine iko nyeusi kama strungi. Sasa mimi naweka hapo, inawasha, inasafisha siku 2-3, tena iko tu pale naona hiyo kitu tu nafanya hivi. Ndio wakaniambia hapana, wewe acha tukuangalie, tukuandikie barua uende Kikuyu.
So kwa muda gani
wanajua macho.
Kwa muda gani kabla uende Kikuyu?
Nilikuwa 2 years nikiwa hapo Kibera, 98 na 99. Sasa takwenda Kikuyu, ndio wakaniambia ndugu yangu, hii jicho imeenda. Wakanipatia namba hapo, soma. Nikifunga hivi, hiyo ni kitu. Wakifanya taa hivi, ndio mimi naona hiyo taa. Lakini jicho yenyewe haioni.
Na ulikuwa unasema pia kuna wakati ulikuwa unaumwa na kichwa sana.
Wakati sasa kichwa iliniuma wakati nilitengenezwa. Mimi sikurudi.
Okay.
10 good years. Sikurudi Kikuyu.
Okay. Then what exactly causes glaucoma? Because it says no symptom.
Yes.
You won't even know, you won't notice, right?
That's the problem with glaucoma. The pressure you're not normal one day, and then the pressure doubles the next morning. It goes up slowly over years, and the eye attempts to adjust. And so because of that, and because most probably the other eye is normal, with both eyes open you see, unless now the glaucoma that happens because something acute has happened, usually accidents.
Is there like a link towards genetics?
We say in glaucoma, if a father or a mother has glaucoma, the risk for the children is significant. And they need to start measuring their pressures once they are 40. In fact, now we're even lowering that to 35. Because you'll never know. So just check your pressure once a year.
Okay.
Exactly.
And for you, Delivan, kuna mtu yote kwa familia yako ambaye ilikuwa na glaucoma?
Kwetu hakuna. Sasa hiyo shida ilikuja tu ni vile, yani sikuwa nikienda kliniki. Nilikaa 10 good years. Siendi. Nimepona. Sasa mimi naendelea na shughuli zangu.
Ukisema umepona, unamaanisha nini? Ulitibiwa, ulifanywa?
Kwa sababu sasa vile nilifanyiwa hiyo operation, nikifanya hivi naona mtu anapita pale. Sasa mimi nikamwambia hata bibi yangu, mimi nimepona.
Uko sawa.
Wacha niendelee na shughuli zangu.
Okay.
Nilikuwa nikifanya kibarua zangu kwa mjengo. Sasa 2014 hapo mwezi wa 8 ndio kichwa ikanianza. Kichwa inauma, inapoa. Tena hapa tu, hii pati hii. Mpaka tajicho saa hiyo inaanza kulialia machozi. Nikaeleza bibi, akaniambia sasa siuende tu upewe painkillers umeze tuone kama itaisha. Nikaendelea kumeza hizo painkiller, nikaona hapana, haiendi mzuri. Nikarudi huko Kikuyu. Ndio Kikuyu wakapima, wakaniambia unajua hiyo glaucoma imerudi, cataracts iko ndani. Sasa hatujui vile tutakusaidia kwa vile wewe umekaa muda mrefu.
Kabla kuja clinic. Unasema kwa miaka 10 haukwenda clinic.
Siendagi.
Okay. Now, is there a way that then it can, because it's like, is it two different things or is it one because of the other?
So I think he raises very important things. One, something called patient education. The reason he didn't go back is because he didn't understand his disease.
And he was operated on.
Finished.
He's okay.
He's okay. The patient needs to understand, okay, what is it? What's the plan? You know, otherwise they just think one intervention and that's it. Then the other issue is the fact that for 10 years, he just never went. Why? Because there were no symptoms. Nothing bothered him. There was no concern. His eye looks normal. Even when his wife looks, the eye looks normal. So there are no symptoms. So if we wait for symptoms, by the time now he was getting symptoms, that's when he's been told now you also have a cataract, you know.
He also mentioned something that after the surgery,
yes,
he was able to see again.
Yes.
But you also talked about the fact that is it irreversible or reversible?
So it depends on where we get it. So we cannot improve your vision, but we can prevent your vision from progressing. I mean your damage from progressing if we get the pressure right. But sometimes the pressure is so high, the eye is steamy. It's like if you boil water in a room, you know how you get steam on the mirrors. So sometimes the pressure is so high that this front part, which is transparent, is just steamy and you can't see. And immediately we bring down the pressure with whatever, your vision comes back. So probably that's, for him, that's what happened. Suddenly he saw this big improvement and he thought,
I'm
done.
okay. Yes.
Yes.
Okay. All right. How about we take a break? But of course, when we come back, we'll talk about then the diagnosis, because you said no symptoms, no nothing. So really, sometimes it's almost too late when people go to seek help. And of course, we'll also talk about Delivan's case of it came back, and then, you know, what happens then from there? Is it worse when it comes back? And of course, just seek more answers as far as glaucoma is concerned. You do not want to miss part B of this conversation. Stay with us. This is Health Diary. All right, thank you very much for staying with us. This is Health Diary, and today it's all about glaucoma. And I would say it's something that we rarely talk about, and most of the times people don't really seek help as soon as they should, which again makes it difficult to even get proper treatment as far as glaucoma is concerned. But of course, to help us with the conversation, we have Dr. Kibata Githeko, who is an ophthalmologist, as well as Delivan Mochoki, who actually recovered from glaucoma since 1998, okay? And he is here to share his story. So thank you very much to both of you. So Dr. can we just quickly talk about then the diagnosis process? What does it look like?
So for you to say you have glaucoma, you must have evidence of damage to the optic nerve. So the question is, how do we identify damage to the optic nerve? We can look. I look at your optic nerve and I can tell you this optic nerve is damaged. There are scans, special scans we do to the nerve. It will show us whether there is damage. Or we can look at how wide you see, not how far. How wide. How far you will see until the day you go blind. And also the intensity of light with which you see. So you find that yes, you can see, but your requirement for light goes up. So you can have normal, and people ask me, so what's normal pressure? So right now, we almost say there is no normal pressure, because we know you can have damage on the optic nerve with a pressure of 15, and there are some people with a pressure of 30 and they have no damage. So it gets very confusing. But generally, we say 21, but with a bit of a disclaimer there. Generally, the diagnosis is not straightforward. And remember, we don't want to brand you have glaucoma and put you on lifelong treatment if you don't have. So sometimes even we have a suspicion, but we wait and monitor you until we're absolutely sure.
Do you then see a lot of patients who come to you
Yes.
when maybe it has progressed? Because then
Yes.
no symptoms.
African studies show that 80 to 90% of all glaucoma patients in Africa are undiagnosed. So you will come because of something else. Remember, he went because of this thing that you're seeing. So you'll come because you went for glasses, you have allergies, something, this, that, and the other. Then when we look, we realize your optic nerve is. What is even worse is that sometimes we also don't look. You know, we're in a rush, it's a busy clinic, sounds like a straightforward, it's just glasses, give you glasses, and we don't look and we miss. Worse, some people don't have glaucoma, and we have branded them that they have glaucoma.
Okay, and then Mwachoki, so for you, the next time ulienda hospitali, it's because you had this really bad headache. Na unasema ilikuwa side moja.
Side moja tu hii.
So ukaambiwa ni macho imekufa. That is what they said.
Imekufa.
Alright.
Sasa nikapigia sister yangu simu huko nyumbani, nikamwambia unajua jicho niliambiwa ilikufa. Akaniambia hapana, kuna madaktari wanakujaga hapa nyumbani wazungu. Wakikuja nitakuita ukuje wakuangalie. Sasa vile walikuja hawa wazungu ilikuwa mwezi wa 11 2016. Sasa kuenda wale wazungu wakapima, wakaona kweli iko glaucoma, iko cataracts. Sasa wakaanza kuongea pale, ndio wakamwambia huyu anafaa tumpeleke atolewe ile glaucoma, alafu cataracts angoje tena wakati mwingine tukirudi aje atolewe.
So at this point ni hii jicho iko na shida, hii nyingine iko sawa?
Hii iko sawa.
Iko sawa kabisa.
Hii
Okay.
dawa yake niliambiwa unaweka ya kupunguza pressure.
Juliambo pia hii nyingine iko na pressure.
Iko na pressure, hata hiyo dawa nilinunua kutoka Kikuyu, wananiambia ikiisha unanunua.
So Dr. what's that? Is that glaucoma on this other end? Because like you said, most of the time it's true, both eyes.
First of all, as we said, most people open angle, almost always in both eyes.
It, yes.
But obviously for him, I think the damage was at different
Mostly
levels.
inward, yes.
It was mostly in the right. So he got the operation done to reduce the pressure, but then he developed a cataract, which then reduces his. So in the other eye, probably the damage was not so bad, or the pressure was not so high.
So high, yeah.
That just drops could bring down the pressures to a good level.
All right.
And so that drop he's talking about, you use it once at night, and before you open it, you have to put it in a fridge. It's a fridge item, you can imagine if you're traveling.
Exactly.
And it's expensive and difficult to find.
Yeah. Mwachoki, so finally, ulipata usaidizi.
Wale wakwale walipotoa hiyo glaucoma, wakaniambia sasa hii cataracts ukirudi Nairobi, fanya bidii wakutoe. Wakishatoa hiyo, utaona jicho ikileta mwangaza. Ndio nikakuja kwa kliniki hapo, wakaniangalia, wakaniambia ulitolewa glaucoma, nikamwambia Sasa kitu ilibakia ni cataracts, nikamwambia ndio. Sasa hiyo cataracts pia inatakana ufanye bidii, utafute 15,000 tuje tukutoe. Ndio wakaniuliza uko na NHIF, nikamwambia ili expire kwa sababu kibarua ndio hiyo sina, nimekaa tu hivyo. Kaniambia sasa wewe enda ujaribu, kwa vile Disemba inaisha, ukiweka ikifika mwezi wa pili wa tatu unaweza kuja tukufanyie. Ndio nikarenew. Sasa kufika mwezi wa tatu tarehe 12 hivi, wakaniambia unatakikana hapa tarehe 14. Hata ni kama walitumia 1.25 hour.
Okay. All right. So, Daktari, again, are there other options aside from the medication, or surgery is like the ultimate, form of treatment?
So what happens is, the beauty with surgery, once you do it and it is successful, then you'll find that you don't need drops because now the pressure is normal. Or if you are using maybe 4 different drops, now you just need 1 because now you can control the pressure better. So long term, it's a much better way of controlling the pressure. Also, surgery sometimes works where somebody just cannot afford the drops. They can't afford them. Or if it's very advanced disease where we know this guy is going to lose this eye, we just do surgery to try and bring down. But surgery also can fail. Surgery requires a skill of the surgeon and the facilities, and surgery requires close follow-up. So there are people, and then of course you will develop a cataract. But if you don't have a cataract, maybe you had your cataract removed, then that's not an issue. Yeah, so if you can withstand the side effects, because they also have side effects, it makes your eyes red, gritty, and so on, then we go the drops route. But more and more, because now there are a lot of options, a lot of generics which are well priced, we try and go the drops, the drops route.
Way. Yeah, okay.
But if in the assessment of the doctor, they think where you are, if you go the drops route, you're going to lose it, then we operate. Yeah, so those are the two. There is a third one, a middle one, where we do laser. We use a beam of light to actually burn where the fluid, that angle where the fluid drains out. It brings out the pressure, but not by a huge amount, and sometimes it may need to be repeated 2 to 3 years later.
All right. So Mwachoki, sasa unahisi vipi after surgery imefanywa, sasa unahisi vipi? Maisha imebadilika aje? Like kitambo walikuwa wasema unaumwa kichwa, huwezi fanya kazi vizuri. Sasa uko aje?
Tangu nitengenezwe sijasikia kichwa ikiniuma mpaka wa leo. Nimekaa tu, kazi yangu ni kutumia ile dawa nilipatiwa na daktari. Ikiisha, mimi nakuja ile tarehe ameniandikia, nakuja napima jicho, ananiuliza iko namna gani, mwambia naona iko sawa tu.
So of course, just recently, you know, we all celebrated the Glaucoma week, right? So no umesema kwa madawa, they're very expensive. Kupata ni shida.
Dawa hizo ziko expensive kupata.
So unaweza sema nini either to the government ama, you know, insurance companies?
Kama wanaweza kutusaidia igharamie kila kitu, ukienda hospitali hata kama ni dawa, wewe ni kupeana kadi, unapatiwa dawa zako, unaenda nyumbani.
So Daktari, again, 6th all the way to 12th March, of course, the entire world celebrated World Glaucoma Week, right?
Yeah.
So then what do you hope to see?
So first of all, the reason we really support this is because we need to raise awareness. And, you know, I'll talk to our viewers and say, if you're 40 years, please get your pressure checked once a year. That's an investment of an hour, which can save you a lifetime of blindness. Really, there's no excuse. I think the next thing is to then have a broader conversation with health finance and say, in chronic diseases, how do we help? Because it's like for him, he's a good case. Fine, the surgery NHIF paid, but he's going to be on lifelong treatment. How do we help people with chronic diseases to lighten their burden? There's the issue of the pharmaceutical industry. How do we enable them to bring medications that are well priced? How do we encourage local manufacturing? How do we remove taxes from VAT and these things from medical supplies so that they're able to come? How do we take care of our aged, you know, our elderly? Can we have a system where, you know, per 70 years we take care of your health as a government, as a nation? Those are conversations that people need to have, and people need to take it seriously, because we've had it from the horse's mouth. These are issues people deal with every day.
And of course, a powerful way to end the discussion. Thank you very much, Daktari, for coming by today. Dr. Kibata Githeko, who's an ophthalmologist, Asante Sana Daktari, as well as Deliver Mwachoki, who again had glaucoma, but of course he is okay right now. And of course, just sharing his experience as well. But on that note, take a look at this health tip.
Let me show you the workout for the back muscles. This is what we call barbell deadlift. You hold it that way, all right? Then bend your knees slightly as you go down. Going down, put your back straight, yeah, and back, all right? Make sure your back is curved, all right. Okay, next one is rowing, which goes to the upper back. This is how you do it. With the barbell, hold it this way, then you bend your knees slightly, back curved, then you row from down, up, from down, up. We also have what we call one-arm row. And I'm going to use this dumbbell to show you what one arm row is and how to do it. Hold it this way. All right, be in that posture. Look at my back. Then from down, row it up. 1, hold it up. 2. All right. Now what you do, you change the leg position to this side as you row. All right. That is what we call one arm row for the back.
Now, the world recently marked Glaucoma Week, which happened between the 6th and the 12th of March. The message is, you as a person, make sure that you go to a hospital at least once in a year to make sure that you get your eyes checked. Well, that has been such an insightful conversation right here on Health Diary. Thank you very much for watching. And of course, a special thanks to 4 Points by Sheraton for hosting us. My name is Winnie Lubembe. If you have any other question in relation to the topic of discussion today, feel free to interact with us on our social media platforms. Until next time, adios.